Cindy Moore. I'm an ENT at SIU ENT. I'm a specialist in laryngology and professional voice. I'm also the assistant program director for the residency training program. I grew up in a small town in southern Illinois called Staunton, Illinois, about an hour south of here. And I grew up in a big family. I was the youngest of 6 kids, and nobody in my family was interested in medicine or went into medicine except for me. So I'm the first physician in my family. A lot of my passion for medicine, I think some of it came from my older brother, who's a wildlife biologist, and my sister, who was a dental hygienist. Those are probably the closest. But the most important influence was my mom, because she was a teacher for 45 years, and she really kind of passed on that passion for education that I have today in teaching residents. Who am I outside of medicine? Well, medicine is a lot of my life, but I'm married to another doctor. He's a urologist, and we have 2 wonderful children. And so all my time spent outside of medicine is really dedicated to my family. That was one of our favorite things about coming back to Central Illinois, is that's where family is. And so being closer to our parents, our siblings, that's really been so wonderful for raising our children close to family. What influenced my decision to go into medicine? I would say I feel like I always knew I wanted to go into medicine. When I was in 2nd grade, I said I wanted to be a doctor. So kind of my whole life I've been on that path. And then, you know, in undergrad, I had a wonderful opportunity of doing an internship and shadowing different physicians, and that was critical in kind of my decision-making for going into medical school. Seeing all of the physicians and the patients that they care for, I knew that's exactly what I wanted to do. So I did my medical school here at SIU School of Medicine, and that really gave me kind of the tools and the knowledge I needed to succeed in medicine. They have a problem-based learning curriculum, and I thought that really prepared me really well for residency. And so my husband and I, we wanted to stay together, so we both went to the University of Mississippi Medical Center for our residencies, and that was an amazing 5 years for us, because you learn so much and you grow so much in residency, and that's where you really learn how to be a doctor. So we spent 5 years in Mississippi, and then I decided that I wanted to subspecialize in ENT. And so I fell in love with patients with voice and breathing problems because I just love the satisfaction of making them better. A patient comes in with hoarseness, unable to talk, and then there's procedures that I can do to give them their voice back. And it's just really fulfilling. And the same thing for breathing. There's patients that for some reason get narrowing of their windpipe, making it harder for them to breathe. And so there are procedures I can do to give them their breath back. And it's really fulfilling to have that kind of instant gratification from those surgeries. And so that kind of led me to a fellowship in laryngology and professional voice. I did that at the Vanderbilt Voice Center in Tennessee. Got to see kind of the full spectrum of pathology there, from singers to just your regular teachers or anyone else with breathing problems. And so from there, I got a great training in those diseases. And then we had to decide kind of where we wanted to go next, and SIU just felt like home. So I take care of a lot of professional voice users, and that doesn't necessarily mean professional singers or professional politicians. It's really anyone that uses their voice for a living. So it's teachers, it's doctors, it's nurses. Anyone that has to communicate for their job, they are a professional voice user. And so if your voice is making it harder for you to be able to do your job, then I would be happy to see you in my clinic and see if there's anything I can do to improve your voice.